And I'm one of the paediatric dietitians. I'm speaking on behalf of Warrington and Halton teaching hospitals. So just up on the screen here, I've got some pictures of our team. The one at the bottom is the team on a charity bike ride that they did for Diabetes UK. During the pandemic, we've kind of tried to find ways where restrictions apply, that we can still continue to meet up as a team whenever possible. So we're a team of two consultant paediatricians. Myself as a dietitian, I work part-time. We've got 3 nurses, 2 of those work part-time, a transition nurse. We're really lucky to have Chloe, youth worker, who's just recently joined our team. She's not on the pictures there, but I'm sure we'll get some pictures with her soon, and Maureen, our administrator. So just to go over, first we sort of decided on our purpose, which is to empower our children and young people with diabetes to self-manage their diabetes in order to live a healthy lifestyle and achieve their full potential. So once we'd got that, we kind of sat down and looked at some ideas. Each of us brought some different ideas of what we thought would be good to focus on. We also looked at the latest MPDA report, and from that, one thing that stood out is that we'd only managed to get carb counting within 2 weeks of diagnosis for around 66% of our patients, and I think that number had been relatively static. So we unpicked that a little bit further and thought about kind of reasons why that might be, and looked at what we'd been doing. So I think sometimes you can get in that cycle of just kind of doing what you've always done. And until you do projects like this, it really gives you the opportunity to kind of unpick and evaluate what you're doing and why you're doing things. So as a team, I think we're all quite passionate about getting that education in as early as possible, but balancing that with not overwhelming the patients when they're on the ward at diagnosis, being mindful of the ward constraints with the nursing teams and things like that, and also the fact that parents and patients are kind of exhausted, overwhelmed, just want to get home. So we've always kind of touched on carb counting initially, but it's very much been education that's been delivered when the patient and the family get home, and we've kind of unpicked the pros and the cons to this, and also some barriers which have stopped us from being able to deliver that education within the 2-week time frame. So some of the main barriers that we identified, especially since I've come back from maternity leave, and obviously we're not doing any home visits currently, so then has become the issue of having the room availability so that we can get the patients in to do the education, and an appropriate room, with the appropriate ventilation and number of people and things like that. Another barrier has been staff capacity. So I've returned part-time. So what would happen if a patient came in on one of my non-working days, and having to look around that challenge. Another thing that we've noticed is that sometimes patients can be reluctant to move away from the set doses and can cancel appointments, either because they've got other commitments or potentially because they're a bit fearful about moving on to that next step. And I'll discuss this further on in the presentation, but I think that's one thing that we've realised there's real value in sort of setting the expectation and carb counting being the norm right from diagnosis, rather than sort of briefly mentioning it and then doing the rest at home. We've recently had some quite complex patients. So one that springs to mind, a relatively new patient with where British Sign Language is their first language for the patient and for both parents. So, barriers around getting resources and ways to make carb counting accessible and easier for them as well. As I've mentioned, some general challenges of COVID, things like not being able to do home visits and social activities and things, and also ward staff training. So what we've done so far, the things we've kind of put into action, we've broken these down into a few categories, but just overall communication. So I think as a team, we've always communicated quite well, and we've been very passionate about all speaking from the same hymn sheet and trying to, get the same messages across to patients. But I think this project has really focused us and really given us the opportunity to kind of communicate, brainstorm ideas, work together. So it's definitely strengthened the communication in the team. From a capacity point of view, so as I say, I've come back part-time, so one of the challenges was what happened if a patient comes in on my non-working day. So we've managed to speak to my colleagues and arrange cover for them to go onto the ward and do any education or training that might be needed, and even potential discussions around whether we might be able to use one of our assistants to do a little bit of training as well around carbohydrate counting, some interactive sessions and things. We've also managed to secure a room, because as I said, room availability was an issue. So we've managed to secure a room on a Friday afternoon for patients to come and do some carb counting with us on site. So that's overcome that problem as well. Some of the other things that we've put into place. So we were previously giving out Carbs and Cals books to patients. We had a stock of them, and then that's run out. So we've used some charity money to purchase some of the books, especially for patients where they don't like the app, or they're not as confident with using the app. I think the book is also a really good resource. So we're able to give one of those to each newly diagnosed family. We've also, I've also updated our information that we give out to newly diagnosed patients, just to make it a little bit more, as I said before, setting that expectation of carbohydrate counting straight from the start. So they're explained the time frame of what the education will be, and introducing them to label checking, identifying carbohydrate a lot more clearly right from that initial consultation. But we are still doing the education, once they've gone home, they've had a good night's sleep, they're settled and relaxed, as that's generally a better way for them to learn. We've organised some regular carbohydrate counting training for ward staff, and we're looking at getting some posters that we might put up on the ward just to raise a little bit of an awareness with staff. And we've also, as a team, changed the way we do things in our terminology. So we were using units for 10 grams of carbs, and we've now switched to insulin to carb ratios. And all the team's been trained on delivering the education that way, rather than the way that we were doing it previously. So I think I've covered most of these points. So yeah, we've provided more flexible training sessions as well to the ward staff, as I mentioned before. And another, since Chloe, the youth worker, has come on board, she had a really good suggestion of doing some cooking sessions. To start with, that might be interactive over Teams, but hopefully eventually kind of face-to-face with the families, and just making it fun and incorporating carb counting in with that as well. And then another thought that we've had, something that we're putting into place, is trying to set up recording some video education sessions, especially, as I mentioned at the start, the patients where British Sign Language is their first language. They've had some challenges with our resources, so we thought this would be a really good way for people to be able to watch some carb counting training videos and have a British Sign Language interpreter on them as well, so that they're accessible for all. So just finally, quickly, our most important piece of learning so far. So we've really realised, again, since having to sit down and focus on our project, is that there was lots of things that we could do quite quickly and quite easily that would make the process better and hopefully improve the amount of patients that we can get carb counting within the 2 weeks. So just little things like solving the room availability issues and switching to insulin to carb ratios. It hasn't been too time consuming, but actually it's given some good results. It's really allowed us to make some time for the project and also for some team building activities outside of the project as well, which has been enjoyable and has obviously helped us to continue to build on learning each other's different communication styles and just having a nice time together. So our plans going forward, as I mentioned, with the educational videos and maybe some e-learning modules as well, just to make it a little bit more accessible for patients in their own time, and again to overcome that barrier where we might have patients that are cancelling appointments or can't get to appointments. Get the resources in different languages as well. Continuing to work on our resources that we're handing out, and looking at the cooking courses. And that's everything.
Fantastic.